Hello my dear students. I'm Dr. Vaishaly Bharambe. I've been teaching anatomy for last 25 years and I love it. I have something on the screen for you. Let's see what it makes you think, then we'll take it from here. So look at the screen everyone. What do you see? What is this that you're seeing on the screen and what does it make you think? A lot of people and a lot of expressions? Yes? Absolutely. So this is what the lecture is all about. We're going to talk about muscles of facial expression. Okay? So before we start, as usual, I'm going to show you an MCQ. See if you can solve it. Okay? So following is true for buccinator muscle. Remember buccinator muscle of your cheek. Okay? It's a muscle of mastication. It is supplied by buccal branch of mandibular. It arises from both mandible and maxilla. It's covered by investing layer of deep cervical fascia and accumulates food in the vestibule of the mouth. I'm sure some of you have already solved this. Some of you are somewhere close to the answer. But to be able to exactly tick the right answer, you need to really know more about buccinator, a muscle of facial expression. Okay? So let's begin studying of this. Let's introduce the face to ourselves. What exactly is the face? Bound superiorly by the hairline, on the side by the auricles, and inferiorly by the chin and base of mandible. That is the extent of your face. The face consists of skin and superficial fascia. Note, it contains no deep fascia. Now this is a very important finding. There is no deep fascia in your face. The rest of the body, as you know, does contain deep fascia. So what are we going to cover today? We are going to cover the skin and superficial fascia, including the muscles of the face. The superficial fascia also contains nerves, arteries, veins, lymphatics, which will be covered in another topic along with the applied anatomy. Today we are concentrating only on muscles of facial expression and what expression they bring about. Right. So these are my 3 lectures on face. Muscles of face, which is today. Nerve supply of face, which is another lecture, and arterial, venous, lymphatic drainage and applied anatomy of face, which is another lecture. The links for these 2 lectures are also given in the section and you can go and also check out those lectures and see if you can learn from them. A few points to be noted. Remember, your skin of the face is very vascular, it's lot of sweat glands, sebaceous glands, and it provides anchorage to muscles of facial expression. So every time the muscle contracts, your facial skin changes position, bringing about variable expressions. The superficial fascia of the face contains fat, blood vessels, lymphatics and nerves, like I told you, and it contains muscles. These muscles are called as panniculus carnosus, which is muscle in superficial fascia. So what's so special about this? What is special is that you don't normally get muscles in your superficial fascia, isn't it? It's only in face and a few other places that you get muscle in superficial fascia. Development, all these muscles develop from the second branchial arch and are therefore supplied by the facial nerve. Just remember this one sentence. All muscles of facial expression develop from mesoderm of second branchial arch and therefore supplied by facial nerve of second arch. With this basics in place, let's go and study the muscles. First, a question. Why were these muscles formed? These muscles are around 3 orifices in our face. Okay. Students, our face has got 3 orifices, an orbital orifice, a nasal orifice and an oral orifice. These muscles were actually formed as guards for these orifices. Either they would close the orifice or they would open the orifice. Sphincters / dilators. That was their actual function. Then, what about facial expression? Right. So our much evolved brain has learned to use these muscles for expression. So this slide says that Muscles of facial expression are actually made for purpose of controlling the orifices of our body, face, orbit, nose and mouth. Expressions that come are developed by our much evolved brain as a side effect. Okay? Right. So let's describe these muscles. I'm going to group these muscles into muscles around the eye, muscles around your nose, and muscles around your oral aperture. Okay, so let's begin with the muscles around the eye. So now I want you to read with me. Don't just read it here, read it aloud. Okay, Orbicularis oculi, levator palpebrae superioris, corrugator supercilii, and occipitofrontalis. 4 muscles around your eye. So here now I'm talking about the orbicularis oculi. I want all of you to take a look at this beautiful eye that has been developed, and you can see that around it there are a lot of fibers. The orbicularis oculi muscle is divided into 3 parts. Okay, a palpebral part which you are seeing here, which is going from one end of the medial palpebral ligament to the raphe to the other side. The orbitary part, which consists of fibers which are concentrically arranged, all meeting at the medial raphe. Action of these is when your palpebral part contracts, your eyes just gently close as in sleep. Okay, do that. Please perform this action. Get your eyes to close gently as in sleep. But when all these parts act together, your eyes are literally scrunching together, coming medially. Okay, so the entire muscle contracts and tries to bring everything close to the medial angle of the eye. It's often when you do this, especially when you're facing a lot of light, okay, you look somewhere against light, you develop these small creases on the lateral angle of the eye, which are called as crow's feet. Okay, so all this is because of action of orbicularis oculi muscle. Who opposes its action? Levator palpebrae superioris, which will help to open your eyes. So, paralysis of orbicularis oculi therefore will be unable to hold the eyelid in place. Okay, so eyelid begins to droop. This condition is called ectropion. Please observe here how the eyelid is drooping down. Okay, this is called ectropion. Because the eyelid is drooping down many a times, okay, there are tears rolling down the eyes. At the same time, the lacrimal part of the orbicularis oculi usually helps to adjust the lacrimal puncta so that the tears are drained regularly. But in the absence of orbicularis oculi, the tears are unable to drain the natural way, often get collected in the eye and drip down the face. This condition is called as epiphora. So, ectropion and epiphora are results of paralysis of orbicularis oculi muscle. Right. So, now we come to the next muscle, corrugator supercilii, going from the frontal bone across to get attached somewhere beneath your eyebrows. So when it contracts, it causes these eyebrows to move medially, causing vertical creases to appear on your forehead. Can you see the vertical creases appearing here? That's corrugator supercilii. Next time you do that, understand which muscle you're using, okay? Right. Now we come to the frontal belly of occipitofrontalis. I'm sure all of you are aware of it since you've done the scalp. Okay, so the muscle of the scalp is your frontal belly and occipital belly of occipitofrontalis. When this muscle contracts, can you see those horizontal lines on his forehead? Okay, this kind of lines. Now these are caused by frontal belly of occipitofrontalis. That's the expression you have. Oh my God, what a surprise! Fright. Okay, all these expressions of surprise, horror or fright and these horizontal creases on your forehead is your frontal belly of occipitofrontalis. Okay, so let's revise. We saw these 4 muscles, orbicularis oculi, levator palpebrae superioris, corrugator supercilii, frontal belly of occipitofrontalis. Okay, so 1, 2, 3, 4. That's it. Now let's go to the next group of muscles, muscles around the nasal aperture. Okay, so you studied how your eye was controlled. Orbicularis oculi would close it, levator palpebrae would open it, corrugator supercilii would affect the surrounding, and so would the frontal belly of occipitofrontalis. Now what about the nasal aperture? So around the nasal aperture you got three muscles: procerus, nasalis and depressor septi. Please say it once: procerus, nasalis, depressor septi. Now here is your procerus. Can you see these two muscles here? You can see that they take origin from nasal bone, okay, but disappear and blend with the frontal belly of occipitofrontalis. When they contract, they cause horizontal wrinkles on your at the bridge of your nose. Take a look. This is the procerus muscle. Can you see the horizontal creases on the bridge of her nose? This is procerus at work, transverse creases. The nasalis muscle is having two parts to it: a compressor nares that will narrow your nose, a dilator nares that will widen your nostrils. Okay, let's take a look. That's your compressor nares. Okay, can you see how it's narrowing down her nostrils or the upper part of her nose? And here is dilator nares. This is the nasal dilatation. You can see how his nose is getting dilated as he is angry. So usually dilator nares is something you use when you are angry. What muscle is not seen here is depressor septi, which also assists in the process of anger by controlling the nasal septum in the process. Okay. So we come to revision. Muscles around nasal aperture. There are three: procerus, nasalis, depressor septi. Okay. That's the, yes, procerus, that compressor nares. This is the dilator nares, and then below the nose exactly here is your depressor septi. Okay. So we've now covered muscles around the orbit, muscles controlling the nose. If I ask you who causes surprise, your answer should be frontal belly of occipitofrontalis. Who causes frowning? Corrugator supercilii. Who causes anger, expression of anger? Nasalis. Which part? Alar part of nasalis. Okay. Now let's go to muscles around the oral aperture. I want to introduce these muscles to you first, then we'll talk about them. Levator labii superioris, alic nasi, levator labii superioris. See, remember where these muscles are concerned, which are going to your oral, controlling your oral aperture, they are divided into two types. Muscles that are dilators, opening your mouth, muscles that are constrictors, closing your mouth. For process of opening, somebody has to lift up your lip, somebody has to pull down your lip. Okay, so elevators of lip called as levator labii superioris. Levator, elevate. Labii, lip. Superioris, present superiorly. So you got two levator labii superioris. One is giving a branch to the bundle of fibers to the nose, hence called alic nasi. You also see two muscles here, zygomaticus minor, zygomaticus major. Okay. Here you are seeing a depressor labii inferioris. See, so you have a levator labii superioris, so you have a depressor labii. So this will depress your lip. Okay. Along with it, there is a muscle called mentalis. Now there is zygomaticus major, rhizorius and depressor anguli oris and levator anguli oris. A lot of muscles, I accept. Okay, but as we learn about them, you will find it quite easy, I assure you. Can you try and revise with me once? See if you remember. Muscles that are lifting the lips up, levator labii superioris. One giving fibers to the nose, levator labii superioris, alic nasi. One muscle that goes from the zygomaticus minor, a muscle going again from zygomaticus major. You have rhizorius, here you have depressor anguli oris, levator anguli oris, depressor labii inferioris and mentalis. Just if you keep saying these terms, they will become more familiar to you. Let's now discuss all these muscles one at a time. Muscles around the oral aperture are therefore divided into sphincter muscles. Just keep observing. See, each arrow is one muscle, okay? So, levator labii superioris alignasi, levator labii superioris, levator anguli oris, okay? From below you have mentalis, depressor labii inferioris. From the side you have 5 muscles. Zygomaticus minor, zygomaticus major, buccinator, risorius and depressor anguli oris. So understand that muscles around your oral cavity are sphincters and dilators. All these muscles that you are seeing here are all dilators. The red ones are lifting your lip up. The blue ones are lifting your lip down. And the black ones are acting from the side. Okay. Then who is the sphincter, madam? The sphincter is the orbicularis oris muscle. These concentric circles are your orbicularis oris muscle, which is acting as the sphincter. Right? So I'm not going to read all this. These are the muscles you are supposed to study now. So let's talk about those red ones. The ones that are attached to the upper lip. Okay. So here you are seeing levator labii superioris alignasi, which is attached partly to the upper lip and partly to the nose. Then just purely to the upper lip, levator labii superioris, and finally zygomaticus minor. 3 muscles. Can you repeat it once? Levator labii superioris alignasi, levator labii superioris, zygomaticus minor. How do they act? They all evert your upper lip. They act on the upper lip, pulling it upwards and outwards. Okay. They also deepen your nasolabial furrow. Pay attention. This is asked in MCQs very often. They help to deepen your nasolabial furrow. See, there is a groove here on your face. That's called the nasolabial furrow. They will deepen it by their action. Okay. Now let's talk about muscles attached to lower lip. These are going to be depressor labii inferioris. When this muscle acts, it pulls the lip downwards as in eversion of lower lip. This is called expression of irony. Great, good, wonderful. That's called as eversion of lower lip as in expression of irony. There's one more muscle here called the mentalis. This will tighten your chin. Okay, so which is something we do when we have an expression of disdain. It's not looking nice, but that's the expression we do give sometimes. It's an expression of disdain. This is by mentalis muscle. Okay, so we've done 2 muscles, depressor labii inferioris and the mentalis. Depressor labii inferioris giving expression of irony by everting lower lip, and mentalis tightening your chin. Right. So now 5 muscles attached to angle of the mouth. Let's take a look. This is zygomaticus major. Coming from zygomatic bone to the angle of mouth. This is a muscle that gives you joy. It makes you laugh. Okay. The expression of laughter comes from zygomaticus major. Can you see? He's having a good time, I'm sure. Now, muscle that helps you to grin, just a smile. That's your risorius. See, she's got a smile, but she's not laughing, is she? Right. Then you have depressor anguli oris, pulling the angle of the mouth downwards. This is expression of sadness, given by depressor anguli oris. Opposite to that, above, is the levator anguli oris. So when this contracts, it pulls the angle of the mouth upwards. But as it does so, it accentuates the nasolabial furrow, which is actually again an expression of sadness. Okay. So you saw 4 muscles deepening the nasolabial furrow. Okay. Question for all of you, what is risus sardonicus? Find out and give me your answer in the comment section. Right. We now come to one muscle called as the buccinator. Okay, the buccinator is the muscle of your cheek. Please palpate your cheek, everyone. Here, this muscle that's forming your cheek is your buccinator. This muscle takes origin from maxilla and the mandible, travels forward till it reaches the angle of the mouth. Okay. There, now watch on the screen. It divides into upper and lower fibers that travel from here, contributing to formation of upper lip and lower lip. The middle fibers, as you can see, cross each other. Lower fibers going to the upper lip, upper fibers going to the lower lip. How does it act? It contracts the cheek, pulling it towards your teeth. So when you're eating, any food that has gone in this vestibule of your mouth is forcibly pushed between the cheek, and therefore they act as important muscles helping in mastication. They're not muscles of mastication. They help in mastication. They also prevent accumulation of food in the vestibule of the mouth. So they also forcibly expel air from the mouth. That is your buccinator. Okay. So it's forcibly expelling air through your mouth. Right. We come to the one very important muscle. All of us have always been in awe of it because it's become so famous as the kissing muscle. Don't bother about that. Just understand that Orbicularis oris keeps your mouth shut. It closes your mouth. Okay. It's divided into extrinsic fibers and intrinsic. Muscles from outside come and contribute to formation of this highly complicated Orbicularis oris muscle. And there are some fibers of its own also. So from outside there is a deepest fibers, intermediate fibers and superficial fibers. I will not discuss this. Let's go further and discuss it with actual images. So what you are seeing here is two muscles from above and two muscles from below, incisivus superior, incisivus inferior, which are forming the deepest stratum of Orbicularis oris. This is followed by intermediate stratum. From deep to superficial, intermediate stratum is completely buccinator muscle. Upper fibers, lower fibers, intermediate fibers, everybody forming the Orbicularis oris intermediate stratum. And superficial stratum is formed by all these muscles that were coming from above into the lip, from below into the lip, and so on. So, mainly by levator anguli oris and levator anguli, depressor anguli oris. Also majorly contributed by zygomaticus major minor, levator labii superioris, depressor labii risorius and depressor labii inferioris. All these contribute to formation of the superficial stratum of Orbicularis oris, also a muscle called mentalis. So, and finally, there are fibers connecting this Orbicularis oris to the overlying skin. Okay, so that's Orbicularis oris muscle, deep, intermediate and superficial stratum. What are its actions? It closes your lips. It just closes your mouth. All others were dilating. Somebody was pulling lip up, somebody was pulling lip down, somebody was pulling the angle sideways, right? What is Orbicularis oris doing? It's closing your mouth. Okay. It helps in mastication by compressing the lips against the teeth, just like the buccinator. It causes protrusion of lips also. And it helps, of course, in speech. Right? So with this, we've done the muscles of facial expression. Quite a lot information given to you, but a revision will help you to catch up. So you can see that there are the laughing muscle is zygomaticus major, the grinning muscle is risorius, there is an expression of irony by depressor labii inferioris, a disdain by muscle mentalis. Frowning corrugator supercilii and procerus, anger dilator naris and depressor septi. Sadness meaning the nasolabial furrow will become prominent. So, levator labii superioris, alicinaceae, zygomaticus minor, helped by levator anguli oris. Surprise and horror, oh my God, is the occipitofrontalis. Squinting against light, there is too much light, I cannot see. Orbicularis oculi, it's all your eye muscles getting contracted and then you are trying to squint. Okay. Eyes shut as in gently sleeping. That is which part of Orbicularis oculi? Is the palpebral part. Gentle sleep and tightly scrunching. There is a difference. and of course the kissing muscle, Orbicularis oris. Right. So these are all the expressions you saw today. You learnt more about them. You learnt how each muscle is causing these variable expressions. For example, now you can see him laughing. Which muscle? Yes, zygomaticus major. You can see him highly surprised, isn't it? So that is frontalis. Yes. This one is vertical creases on the forehead, corrugator supercilii. Horizontal creases at the bridge of the nose, procerus. Again vertical creases, corrugator supercilii. This guy is so angry. Yes, he's very angry. He's dilating his nostrils. Yes. Nasalis. It's the nasalis. Which part? Dilator nares. And she is gently smiling. So which muscle is that? That is the risorius. So these expressions actually should bring you into the game of this class. Muscles of facial expression. Okay. If you understood this, let's go to solving some basic MCQs. The same one that we started with. Okay. Same one. Okay. Following is true for buccinator muscle. Is a muscle of mastication. Is it? No, it's not. It's an accessory muscle of mastication. Is it supplied by buccal branch of mandibular? No, it's developed from second branchial arch, therefore supplied by facial nerve. So that's also gone. Arises from mandible and maxilla. I want to keep it. Okay. Is covered by investing layer of deep cervical fascia? No. Why no? Because there is no deep fascia in the face. Accumulates food in the vestibule of the mouth. Actually, it prevents accumulation of food in the vestibule of the mouth. Therefore, the answer is, it takes origin from mandible and maxilla both. That's the correct option. Knowledge helps you to solve MCQs way more easily. One more MCQ. Lacrimal part of orbicularis oculi strongly closes eyelids? No, that's orbicularis oculi, the entire muscle. Gently closes eyelids, that's palpebral part of orbicularis oculi. Raises the eyelids, that's levator palpebrae superioris, so that's also a no. Pulls the lacrimal canals medially, yes, so that's the answer. One more MCQ, okay. The zygomaticus minor carries out which action? Forms nasolabial furrow? Yes, I know, yes. Draws up the angle of the mouth? No. Draws the angle of the mouth downwards? No. Helps in whistling? No. Who does that? Buccinator. So therefore, forms nasolabial furrow is my right answer. So that's a yes. That's how knowledge helps you to solve MCQs. Okay. One final advice to all of you students, success is never final. Failure is also not fatal. It is the courage to continue that counts. You may have done badly. You may be doing brilliantly. It is just that you should have the strength to continue forwards. That's what's going to take you far. Of course, there is a comment section. You can always give me your comments, ask me any doubts, and I'll do my best to get back to you as soon as possible. So thank you students for watching this video, and I'll see you across the screen in some other video. Thank you so much.